Good evening, everybody. I'd like to welcome you all to tonight's Dechra Academy webinar. This is the first of our series of 3 masterclass webinars on otitis, and tonight's topic is the primary triggers of otitis externa. I'm delighted to introduce our speaker for this series of webinars, Mrs. Sue Paterson, who is an RCVS and a European Specialist in Veterinary Dermatology. She's a very well-known international speaker and the author of an ever-growing number of textbooks and articles on veterinary dermatology. She's based at Rutland House Referrals in St Helens and has a wealth of clinical experience from her very busy referral caseload. There will be time for questions at the end of the webinar. There's a question box on the right-hand side of your screen. If you have a question, please type it into the box at any time throughout the presentation, and we will try to answer as many as possible as the time allows. Thank you again for joining us this evening, and I will now hand over to Sue.
Thank you, Anya. I hope you can all hear me okay. I'm delighted to be invited by Dechra to give you these webinars. You may be interested to know that we have over 1,000 attendees tonight worldwide, people from as far afield as New Zealand and South Africa and the States, as well as the UK and Europe. So a very warm welcome to you all. I hope you're going to enjoy our little presentation. As Anya's already said to you, I am a consultant dermatologist, but I do spend a lot of my time during my working day looking at cases of otitis. And what we're hopefully going to do tonight is to share with you some of the images that we've collected on our travels and discuss tonight primary causes of otitis externa. Okay, let's see if we can get our webinar started, which we don't seem to be able to. Okay, there we go. Let's talk first of all about the etiology of otitis externa. Quite an old system that was first discussed by August was the PPP system, but since over the last few years that's now been changed, and we now describe it as the PSP system. And what that means is we can divide up the etiology into a series of different factors. The first 2 of those factors, the first P and the first S if you like, are the primary and the secondary causes of inflammation. The second P is the predisposing factors, and then the third P are the perpetuating factors. And these are factors that you need to consider whenever you're faced with a case of otitis externa. You need to at least have some mental indication as to what the primary triggers, what the secondary causes, what the predisposing and the perpetuating factors are in each of the cases. Because if you can identify those and manage those successfully, then you can successfully manage any case of otitis externa. What we're going to do to start off with, just as a little bit of an introduction, is we're going to talk about predisposing and perpetuating factors and the role of those in otitis itself. What we know is that they're crucially important and that they contribute to ear disease, but they don't actually cause the inflammation that leads to otitis externa itself. We know, though, if you don't identify them and we don't deal with these effectively, though, that they can lead to a failure of our treatment, and probably more importantly, and particularly when we're concerned with any of the very multiply resistant infections that we now see through our clinics, we can see reoccurrence of infection. So we need to be aware of these and we need to deal with them. Let's expand on that just a little bit as we move on through. First of all, predisposing factors, and one of the most important predisposing factors is moisture in the ear canal. Now that may be something that we introduce ourselves, it may be something that gets into the dog's ear when they're shampooed, it may be something in the way of a water-based medication that we put into the dog's skin, or of course it may be when they swim. We know a lot of dogs when they swim will submerge underwater, whether it's part of their swimming activity or whether it's because they're diving for balls or diving for sticks. But we know if the inside of the canine ear gets wet, it removes a lot of the protective wax that's there. It leads to maceration, this softening of the lining of the canal, and that then can lead on to the development of infection. So moisture is important. Conformation is also very important in too, and there are lots of different conformational changes that we're going to come across when we're examining some of the dogs that come into our clinics. I'm sure we've all seen Shar-Pays. We know that Shar-Pays have these very narrow ear canals. Having a narrow ear canal itself doesn't actually cause disease, but of course once that Shar-Pei has atopy or has, for example, thyroid disease or has demodicosis, the fact that ear canal is very narrow, it pushes the dog over the edge and it will develop overt signs of disease. We also know that dogs who have hairy ears, things for example like poodles, things like spaniels, dogs that have hairy concave pinnae, again it affects the humidity, it affects the environment inside that dog's ear canal, and that again can predispose it to developing signs. We know dogs that have pendulous pinnae are also very susceptible to these problems, so things as you can see here like bloodhounds, things like bassets, and again things like spaniels, the Clumber Spaniel particularly, the Cocker Spaniel, the Springer Spaniel are all predisposed to developing otitis through the conformation of their ears. Obstructive disease is not something we see quite as commonly, but we do know animals that develop obstructions within their ear canals can then be pushed over the limit and cause overt disease. In dogs, we may see something like this. This is a polyp within a dog's ear. You can hopefully see it here in the wall of the canal. And what you can see here is this polyp is actually emanating from the wall of the canal itself. In dogs, polyps almost always come from the horizontal or the vertical canal, and you can tell because you can get round the side of it, but you can't get round the whole of the body of the polyp. Most commonly they derive from ceruminous gland, hyperplasia. They can cause blockage in the canal, again changes in the pH, changes in the humidity and the ventilation, and they can then predispose to disease. However, if it's a cat, it's far more likely, as you can see on the right-hand side of your screen, that that polyp is coming from the middle ear. And these polyps can be very difficult to manage, and again they can push animals over the face and cause disease by causing changes in the humidity within the ear canal. Typically with these nasopharyngeal polyps you can move all the way around the outside of them. They're not attached to the wall of the canal because these are coming usually from deep within the tympanic bulla itself. So obstruction is something we need to think about. Perpetuating factors are another thing that we need to consider when we're looking at disease, and the two most important of these are chronic damage to the ear canal and otitis media. Otitis media isn't something we're going to deal with a lot tonight, although if anybody wants to ask questions at the end, we can certainly develop that subject. But chronic damage is something that is very commonly poorly managed by people in practice. And chronic damage is one of the reasons why dogs fail to respond to therapy adequately, or why we have reoccurrence of infection. We know that the ear canal is a tube of skin. We know that tube of skin is contained within a cartilaginous exoskeleton, if you like. We know that skeleton actually prevents expansion of that skin, so that when we get swelling within the canal, it will cause narrowing of the lumen of the canal. We also know the inflammatory process leads to hyperplastic change within the glandular tissue within the canal wall itself, and that then leads on to produce some of the chronic change that we see. This may be an ear canal that you're presented with, and this may be a dog that may have allergy. This may be a dog that's had infection. It may well be that we've resolved the infection adequately. We've dealt with its malassezia, we've dealt with its staphylococcus. But what you can see on the lining of this canal is you can see some erythema. You can see, hopefully, up in the top right-hand corner here, this cobblestone appearance, which is very typical of ceruminous gland hyperplasia. If we don't go on to try and correct these changes in this canal, this dog is going to relapse and it's going to go on to develop disease. Here's another one you can see in the top right-hand corner. This is the same sort of principle, and again you can see these almost polypoid growths here lining the wall of the canal, again ceruminous gland hyperplasia. At this stage, when we're looking at dogs' ears with these very mild changes in them, this change is reversible. So if we now treat this animal with steroids, we might use topical steroids, perhaps combined with an ear flush or an ear drops. We may use systemic steroids, perhaps in the form of anti-inflammatory doses of prednisolone, or we may even inject steroids into the wall of the canal itself, almost like a ring block. We can reduce these chronic change and therefore prevent relapse of the disease. If unfortunately though that disease is allowed to continue, the disease starts to become more severe, as you can see here, and once we're getting these much larger polypoid growths, as you can see in this bottom left hand corner here, this change is now starting to become irreversible. As it moves on and we see further damage, we start to see fibrosis of the canal, and at this point these ears are now becoming chronically, irreversibly damaged. And at this point, it doesn't matter how well we deal with the infection, how well we manage that dog's Demodex or its atopy, this dog is not going to respond to medical therapy. And at this point, this dog, unfortunately, is going to need surgical intervention. So if we can identify the changes that are present on the ears early, if we can correct these changes, then we can help manage some of these perpetuating factors. Okay, so having looked at those very briefly, they're not really the theme of our talk tonight. Let's expand a little bit now on these primary and secondary causes of inflammation. Let's look at these secondary causes first, and these are essentially infections. Yeast, of course, in the form of malassezia, and then, of course, bacterial infection, whether it's gram-positive infection. Staphs and streps are the most common bacteria we're going to find in acute forms of the disease. We tend to see gram-negative infection, things like Pseudomonas and Proteus in the much more chronic disease. However, the normal ear canal contains bacteria, the normal ear canal contains yeast, and unless that ear canal is actually diseased, i.e. in a healthy ear, those don't actually cause disease themselves. So it's only when we start to see damage to the ear canal by the inflammation induced by the primary triggers, which we're going to talk about tonight, often in combination with these perpetuating and these predisposing factors, do we actually see the disease process starting to move forward. So it's a combination of all these different factors that we need to consider when we're managing ear disease. Primary causes. What are the most important primary causes that we're aware of? Well, we're going to share with you in a few minutes some of the papers that have been published looking at the primary causes of otitis externa, but these are the most important of the primary causes, and we're going to talk a little bit about all of these tonight. What I'm going to try and do, though, is I'm going to try and talk in the most detail about the diseases which are the most important and are the most common, and those are the first three on our list: allergy, parasites, and endocrine disease. The other diseases we'll talk about in a little bit, but not in a huge amount of detail. They're more interesting, they produce beautiful, florid pictures, but they are, for the most part, very rare causes of otitis externa. But we'll touch on them a little bit. Okay, let's talk about a few of the papers that have been published. This was one of the first papers that was published. This is a really important paper, not just for its description of ear disease in the dog, but also for its diagnosis of food allergy. This is Ed Ross's paper, which was first published in 1993. An awful long time ago, and this produced this really interesting fact that dogs with food allergy could have signs of otitis externa. This was a paper that we presented. Again, this is quite a long time ago, back in 2002. This was presented at the ESVD conference in Nice. And this is a review of 200 cases of otitis externa that we'd seen through our clinic over a 12-month period. And each of these cases we'd worked up in detail, and in each of these cases we'd identified a primary inciting cause for their otitis. And what we found, and we'll show you the data in a little bit more detail in a second, we found that allergy was the single most important primary cause. Since then, there's been a whole range of other papers published. This is another paper that was published in 2007. Again, this was a retrospective study looking at the etiology of otitis, looking at 100 cases, and again, this one suggested that allergy was a very important primary cause. And finally, a more recent paper, almost bringing us completely up to date, was looking at this new classification system that we're talking about tonight, looking at these primary, secondary, predisposing and perpetuating factors. This again suggested allergy and then endocrine disease were very important primary causes. So let's just look in a little bit more detail at that data that we presented way back in 2002. And of these 200 cases that we consider for otitis externa, these were the most common of the underlying causes. Allergy comes out top of the poll, as you can see, with both atopy and food allergy being important triggers. Endocrine disease, particularly hypothyroidism and hyperadrenocorticism, immune-mediated disease in the form of sebaceous adenitis, autoimmune disease in the form of pemphigus foliaceus, then ectoparasites, demodicosis, and then this slightly more unusual disease, erythema multiforme. Now, I suspect possibly the data I'm going to show you may be a little bit skewed because, of course, we're a referral practice and we're only seeing difficult cases that are referred to us. Possibly in first opinion practice, primary care veterinary surgeons are going to see more Otitis than we see. You may well see more, for example, food allergy than we see, because many of the cases that we see are, if you like, filtered out before they come to us, because many of the dogs we see have actually had good food trials. Almost any disease, though, can affect the ear. These cases on the right-hand side only had single cases in that review of 200 cases, but again, things like drug eruption, other ectoparasites, vasculitis. Contact allergy is one you want to try never to miss. Zinc-responsive disease, vitamin A-responsive dermatosis, all need to potentially be considered as primary triggers. So let's look at how that data broke down in those 200 cases, and you can see here on this pie chart how that all divides up. And the thing that strikes, I think, everybody first of all is how incredibly common atopic dermatitis is as a trigger of otitis externa. Of the 200 cases that we saw, 150 of those were due to atopy. It is the single most important trigger and is one that often needs to be managed in order to bring otitis under control. As I say, I suspect in primary care practice those figures may be skewed slightly, but certainly food allergy is one of the triggers that we need to think about. You can see there hypothyroidism need to be considered as well, and you can see the others: erythema multiforme, sebaceous adenitis, pemphigus, and hyperadrenocorticism. Let's look at the breeds that were represented in that study, and again this may be a slightly skewed population because obviously there will be differences in the different gene pools in different parts of the country, in the UK, and of course different countries worldwide. But these were the breeds that we saw most commonly that were represented to us, and it's interesting that this doesn't automatically fit with the breeds that we would recognise as most commonly presenting to us for atopic dermatitis. If we look at those tabulated, you can see here that it would appear that there are some breeds which seem to be more predisposed to ear disease than others, and it's interesting to suggest why that might be. It may be, for example, the conformation of the ear, it may be changes in the composition of the wax within these dogs' ear. We really don't know, I think, why some of these breeds are more predisposed than others. And the one that I think is really interesting is the German Shepherd dog. Certainly we don't see a lot of German Shepherd dogs with atopy, but we see a lot of German Shepherd dogs with atopic otitis. It seems to be in this breed that atopy profoundly affects the ears, and far more so than it does the rest of the skin. So let's break down those figures a little bit more, because you can see those atopy figures with large numbers of German Shepherd dogs. A lot of labs, as we would expect. Labradors are a very common breed, and therefore we're always going to see them well represented on any data that we see. Boxers, though, retrievers, Westies, Cocker Spaniels, also breeds that we're very commonly seeing presenting to us with otitis externa triggered by atopy. Food allergy, much smaller numbers with food allergy, but some of the data here actually fits in quite nicely with data from other studies that have been published, which suggest that the Labrador is predisposed to otitis caused by food allergy. The other breeds which were overrepresented in our small study were West Highland White Terriers and Boxers. Dermatocosis, again, some of the breeds that you'd expect to see represented as animals that suffer from dermatocosis: Shih Tzus, Cavalier King Charles Spaniels, Staffordshire Bull Terriers. Boxers, we're going to see in all of the groups both Demodex and atopy, and of course endocrine disease. They're very predisposed to otitis generally. Interestingly, though, Dalmatians, we don't see many Dalmatians with generalized dermatocosis, but we tend to see quite a lot with Demodex affecting their ears. And then our final group here, looking at those most important triggers, is hypothyroidism. Hypothyroidism, again, the sort of breeds we'd expect to be included. We know that Spaniels are highly predisposed. We know that gun dogs, particularly Labradors, are predisposed. But again, Setters, Newfoundlands, Mastiffs, all overrepresented for otitis. So let's expand a little bit more on those primary causes. Let's look at these primary causes in a bit more detail, talk about the presenting signs that we may expect to see, the history associated with these animals, and then let's look at how the animal presents itself. Let's look at the signs we can expect to recognize on the ear pinna. Let's have a look at some of the signs we'd expect to see within the ear canal itself, which can be very different with the different diseases. So let's look at allergy first. We've already said Of all the cases of otitis externa that we see, 3/4 of those dogs are going to have allergies as underlying causes. Of those, we can break them down into atopy, and then food allergy, or perhaps adverse food reaction, as we perhaps ought to call it now more accurately, and then contact allergy, or perhaps contact irritancy, as it may be in some cases. Atopic otitis, first of all. Atopic otitis, breeds that we feel are predisposed to this, as you've already seen, are our Labradors, Shepherds, Spaniels, Boxers, Retrievers, and of course the West Highland White Terrier. Typically, these are dogs starting at a very young age. Typically, as our normal atopic dogs would be, they're starting between 6 and 18 months of age. It may not be that's when they present to us, because it may well be the inflammation starts at that age, but it's only when the dog develops infection that they're actually presented to the practice, but generally they're young animals. And looking in dogs' ears is an incredibly useful indicator as to what's actually going on. If you've got a paralytic dog and you think it may have a flea allergy, have a look in its ears. If it's got otitis externa, it's very likely that it's not a flea problem, or if it is a flea problem, it's not just a flea problem, because 80% of atopic dogs have otitis externa. Often they'll have generalized signs. They'll have obviously signs of pedal pruritus, pedal saliva staining. There may be signs of a ventral pyoderma. It may have periocular disease as well. Sometimes those are very obvious signs to you, but very often those are signs that the owners haven't perceived. Sometimes they accept, for example, that dogs that lick their feet out of habit rather than any sign of degree of pruritus. Interestingly, atopy can present with only otitis externa, and certainly if you look at many of the papers that have been produced on this subject, up to 20% of atopic dogs have only disease in their ear canals. Many times it can be seasonal, and certainly that's one of the advantages of computer records. If you flick back through an animal's records, you can often see they have clusterings of episodes of otitis. It may be in the summer if it's induced by pollen. It may be in the winter, certainly in the UK, if it's induced by house dust mite. So obviously if we get a dog that looks like this, it's very obviously it's got generalized skin disease, and it's not a million miles away to suggest that it's otitis externa, may be triggered by atopy. But sometimes the signs are much more subtle, as you can see from this dog here, the periocular erythema, a little bit of self-inflicted trauma around the eyes and around the face. The owner hasn't noticed this dog has got eye disease, but as you can see, even without looking closely at the ears, this dog has actually got really quite severe otitis externa, secondary to its allergy. Sometimes you have to actually put these animals down on the floor and turn them over. Owners often think you're completely mad if you want to examine the whole animal. That's part of our general dermatological examination in any of these cases. Often they've got telltale signs like erythema on their ventral abdominal skin. Have a look at their feet. Again, owners may not perceive these animals have itchy feet, but the telltale signs of pedal saliva staining can give you a clue. Often you'll find these dogs have signs in their ear pinny before they actually have signs in their external ear canals, and typically these dogs have erythematous ear canals. Often there are no signs of primary lesions at all, just erythema. Often owners are complaining that the animals are shaking their heads, they're rubbing their heads along the settee, they're rubbing their heads along the side of the bed on their owner's knee. Sometimes they'll present with signs of oral hematomas because of constant head shaking. But this is one of the earliest signs you'll see, these little red flags that jump out at you and give you an indication that this dog has allergy. If we have a look down this dog's ear, often you'll see signs within the ear canal before you'll ever see any signs on cytological examination. So if we look at this dog's got a severely allergic ear canal. You can see how much erythema we've got at the top here. This is right down at the bottom of the ear canal, at the bottom of the horizontal canal. What you can see here hopefully is the pars flaccida at the top. Below that here we have the pars tensor. Here this little crescent-shaped structure, this white structure here you can see is the malleus. A little bit of wax here, a few of the hairs, and cytology on this animal would show there's very little to see. But this already is an animal that's starting to show signs of hyperplasia. This is already a dog that's starting to shake its head and rub its head, signs of allergy. Let's look at another one. I put this on really just to show you the very dramatic change you can sometimes see in the pars flaccida. You can hopefully see the pars flaccida up here in this top right-hand segment here of the screen. This one is massively edematous, and this is one of the typical signs that, again, that we see with dogs that have allergy. And I think if you look down the dog's ears and you see this sort of change, certainly in our experience, there's very little that causes that typical edema of the pars flaccida other than allergy. Let's look at food-induced otitis externa. These, again, we've got predisposed breeds, Labradors, Boxers, and Westies. And again, these are often very young dogs. But you will see animals of any age presenting with these adverse food reactions. And we've seen animals that are 12 or 15, starting with ear disease at that age, that have food allergy underlying their otitis externa. 80% of dogs, again, this is a bit like our atopic dogs, dogs can present with only signs of otitis externa when they have allergy, and a high percentage of dogs with food reactions can have otitis externa. If they have generalized signs, those generalized signs can mimic atopy exactly. These dogs can have pedal pruritus, they can have facial signs, so you should not rule out atopic dermatitis, you should not rule out food-induced problems purely on the clinical signs. You need to consider it in both of those groups of dogs. Sometimes, though, what we find is that these dogs do have more pruritus directed at their perianal area than other animals do, and that can sometimes push you in one direction or another. So typically, their pruritus is non-seasonal as compared to our atopic dogs, which also often start with a seasonal incidence. These often have non-seasonal incidence, and often, typically of food allergic types of animals, they're poorly steroid responsive. So animals with pruritus like this, often they're scooting along the floor, they may have had their anal glands emptied, they may have had them flushed or packed or even removed, but perianal pruritus like this often can be a hallmark of these food-induced reactions. Contact allergy. Contact allergy, there's no real breed predisposition to contact allergy. And typically these animals will start 1 to 3 days after the start of therapy. So these will be owners where we prescribe what we think is completely appropriate therapy. It's the right antibiotic, the right steroid, the right anti-yeast drug. But despite appropriate treatment, these animals start to deteriorate. That should start to ring alarm bells, and if an owner's contacting you in those sorts of situations, you need to be aware that they may be developing some sort of contact allergy or contact irritation. You can see it to almost any topical therapy. When we saw neomycin as a common component of ear drops, it used to be a very common trigger for contact allergy, but now certainly through our clinic we see propylene glycol as a very common trigger for contact irritant sites of reactions in ears. And propylene glycol is found in a whole range of different ear drops. It's also found in a large range of different ear cleaners as well, so it's something you need to be aware of. You can, though, even find reactions to topical steroids. Initially, the dogs have erythema, their ears tend to be very pruritic, but as the disease progresses, it becomes much more ulcerative, and these dogs become really very painful. Let's show you some examples of that. This is a dog's ear you can see here with really quite severe ulceration, and you can almost get an impression looking at the distribution of this dog's signs of where the eardrops have actually trickled down the dog's ear. Interestingly, this dog's actually had a lateral wall resection. You can perhaps see that from this area, and that has done nothing to improve its otitis because they haven't addressed the underlying primary cause, which is contact allergy. This one again, you can see graded change, erythema on the ear pinna, as obviously the medication is more concentrated as it moves down into the vertical canal. We've got much more severe signs of ulceration. Both contact allergic dogs. So if we're suspicious we've got allergy, how are we going to investigate these dogs? Well, of course, major differentials are, of course, ectoparasites. So we want to do all the basic investigations we do for any dog with an ectoparasitic problem. Skin scrapes, pluckings, we may want to do bloods looking for antibodies to scabies. We may want to institute some empirical therapy, perhaps with something like some selamectin, if, for example, we're suspicious of Sarcoptes. If we're considering a food trial, then we need to consider looking at the animal's diet and then modifying it appropriately. In a perfect world, we'll go for a home-cooked diet. We'll go for something that contains a novel protein source, a novel carbohydrate source, something that cat or that dog hasn't met before. But unfortunately not every owner has got the time or the commitment to look at home-cooked diets, and so in those situations what we will tend to use in our clinic is we'll tend to use one of the new hydrolyzed protein diets. These are excellent because by hydrolyzing the protein molecules it breaks them up into very small molecules that aren't actually going to trigger an allergic reaction, and they certainly would be my first choice if we can't use a home-cooked diet. You need to feed these and absolutely nothing else, no tidbits, nothing else in the dog's diet at all for an absolute minimum of 3 weeks. And some dogs will show improvement at that time, some dogs will take a little bit longer, but you'll maximise the improvement by 9 weeks. And certainly some authorities will recommend a full 9-week food trial before you think about dietary challenge. If we're considering atopic dermatitis, then we may want to do some allergy testing. But allergy testing isn't a diagnostic technique, it's actually something that helps us manage these cases. So you can actually make a diagnosis of atopic otitis by a process of elimination. Allergy testing actually gives us the tools to potentially add in something like a desensitizing vaccine. And of course, if we're worried about something like a topical problem, a topical irritant or contact allergy, then we want to think about withdrawing all topical treatment. Okay, so if we think we've made a diagnosis of our allergic otitis, what are we going to do? Well, if we put the dog on a food trial and that animal's improved, then the important thing that we need to do is we need to challenge it with the original diet. Atopic otitis can be seasonal, and therefore it's important to check that the reason why that dog's improved is because you prescribed that low allergy diet and not because, for example, we've seen a seasonal change. So you need to reintroduce the normal diet. What I always like to do is I like to challenge them with their original diet while they've still got some of their hypoallergenic diet left. What that therefore means is if they start to deteriorate, you've still got some food to put them onto, because that's what you would do if you start to see signs of deterioration. What we also try and do is we also get clients to add new foods back in on a weekly basis. So if animals do show some signs of deterioration, if they get erythema, discharge in their ears, we can get an indication as to what the trigger factor's actually been. With a contact allergy, if the animal tends to improve on contacts, then obviously that's absolutely great. We may want to have instituted some topical treatment as well if we're concerned. But certainly if you want to then add topical treatment back into that animal's regime, what you need to be absolutely careful of is that it does not contain any of the components of the original topical treatment that caused the reaction in the first place. And that's not just antibiotics, it may be the base, for example, that drug is in. Therapy of allergic otitis, well, that very much depends on the extent of the animal's disease. If the dog has got whole body involvement, so it's got ventral signs and pedal signs as well as signs of otitis externa, then we need to look at a more generalized form of treatment than we would than if just the ears are involved. And it may be at this stage we're reaching for something like antihistamines, we may be reaching for sensible use of prednisolone perhaps at anti-inflammatory dose rates on an alternate day basis. We may want to consider cyclosporin. Or we may, as we do in many of these cases, undertake allergen-specific immunotherapy. If we use cyclosporin therapy, we often have to add topical therapy in as well. Cyclosporin, certainly in our experience, is excellent at controlling atopic dermatitis, but unlike steroids, which will tend to reduce things like wax production in the ears, will tend to reduce the inflammation in the ear canal and keep the lumen patent for us, we find cyclosporin doesn't tend to have that same effect, and therefore often we'll need to add in some topical steroids, for example, if we're using cyclosporin to control the rest of the dog. If the dog only has involvement of the ear, well, we might potentially still offer clients the opportunity, for example, to use something like immunotherapy, because you can control atopic otitis with immunotherapy. Or we may, for example, particularly if it's a very amenable dog, suggest something like some topical treatment. And at this situation we might, for example, use off-license cleaners with steroids added to them to try and prevent the use of chronic antibiotic treatment, as we find with something like ear drops. Let's look at ectoparasites. Ectoparasites are something that perhaps is seen more commonly in primary care clinic than we see in referral clinic, and we know we have ectoparasites that perhaps more accurately affect the ear pinna rather than the inside of the ear, and then parasites that affect the canal itself. Parasites that connect the ear pinna, first of all, Notedries cati, and this is the typical signs that you'll see on a cat with Notedries, this thick, crusted appearance on the ear pinna, massively parasitic ear. This in comparison would be the ear of a dog with Sarcoptes scabiei. You can see on the periphery here where it's actually been scraped already, but almost a papular eruption, self-inflicted trauma through head shaking around the periphery of the pinna. This is what we might expect to see from scrapings from that cat. These are Notedries parasites. You can see these circular parasites with these typical long pedicles on the end of their legs and these tiny little suckers attached to it. Similarly with scabies, differentiation between scabies is scabies mites, as you can see, a similar shape. They have a terminal anus, whereas the Notedries has a dorsal anus. Otitis tends to affect, of course, the ear canal. The discharge is this thick, ceruminous type of discharge, very typical. We see it in both dogs and cats. When you look down the ear canal itself, you'll often see these mites, and you can see on this section here these tiny little white dots that you can actually see with the naked eye dotted around the canal. You can see them here, are actually the Otitis mites deep down in the canal. Samples taken from the canal, examined microscopically, and you can see these large mites. They tend to be oval mites, very different in shape, very different in structure to the scabies and the Notedries mites we've already shown you. Dermatocosis, again, like atopy, can just affect the ear, so you can see animals with dermatocosis in their ears and no signs anywhere else. Demodex is something we need to be very careful that we never miss when we're examining ears in dogs. Often these dogs will have secondary infections as well because many of these dogs are immunosuppressed. So don't be tempted if you look down the dog's ear and you see a thick, waxy, purulent discharge as we've got here, to take a shortcut and send these samples off for just culture. You need to do some cytology because commonly what you'll find, as you can see here, is Demodex mites hidden within the ear wax. How to investigate these cases? As we would do any cases of ectoparasitic problems, scrapings, deep and superficial. Plucks are quite useful, particularly from the ear pinnae, for looking for Demodex mites. Tape strips will help to identify perhaps some of the surface forms of Demodex mite, things like Demodex corneae, Demodex gautii. We may want to do bloods for scabies antibodies. We may want to do empirical therapy. From the canal, it's really important that we look at earwax, and we need to look at unstained samples of earwax. There's a lot of wax there. We may even want to mount it in potassium hydroxide to clear the sample so we can get an indication as to what's actually going on. Treatment, there's a whole range of treatment that we can use for Otitis. And of course, when we're in the UK, we're very much driven by the fact that we should try and adhere as closely as we can to Cascade. So of all the products that you have available to use topically, even though yes, you certainly can use ivermectin or you can use fipronil in ears, most of the proprietary ear drops that are available in the UK have indications for Otitis, so these should be the drugs that we're reaching for first. Systemic therapy, perhaps useful where we've got things like feral animals where we can't use proprietary eardrops on a regular basis. We may want to use one of the spot-ons, and both selamectin spot-ons and moxidectin spot-ons are licensed for use of Otitis and should be the drug we would reach for before we'd certainly reach for something like ivermectin. Demodex can be very difficult to treat when it's found in the ears. Topical treatment, again, we're using this off license. You can use, again, both ivermectin, 1% injectable ivermectin can be diluted down with propylene glycol or liquid paraffin and can be applied daily to the ears. Or you can dilute amitraz, that's Alidex in the UK, 5% solution. Again, can be diluted 1 to 9, again with propylene glycol. That's tended to be applied slightly less frequently than the ivermectin, once or twice weekly. They're probably quite safe if the eardrum is intact, but they're not something I would want to even consider if I had a ruptured tympanic membrane or if I couldn't see the tympanic membrane. Systemic medication is probably the better way to go when we're looking at otic dermatocosis, with either moxidectin, which is licensed as a spot-on preparation that can be used weekly to treat dermatocosis, or again amitraz, again as a spot-on preparation, again can be used, and that's licensed for use as a monthly preparation. You can go off license if you have failures of treatment with topical treatment or with systemic treatment and use oral moxidectin or milbemycin or ivermectin. But we need to be careful obviously with many of these products and some of the breeds that are very sensitive, for example, to ivermectin sensitivity like the collies. Endocrine disease. Endocrine disease is a less common cause of otitis externa, but something that we need to think about. And both hypothyroidism and hyperadrenocorticism can cause otitis externa in the dog. Both of those will predispose as well to otic dermatocosis. So if you're picking Demodex up on samples from middle-aged or elderly dogs, those are the two of the triggers that you need to think about. Generally speaking, we find thyroid disease and Cushing's disease are more common triggers of otitis externa than either hypothyroidism or sex hormone imbalances. So again, if we're faced with a dog with bilateral alopecia, if we're concerned as to whether we should do thyroid function tests or perhaps look at Cushing's first, thyroid disease, if it's got ear disease, would perhaps be the one I would consider in the first instance. Predisposed breeds, again the boxer always comes up on our list, Dalmatians again, setters, gun dogs particularly retrievers, old English sheepdogs are predisposed. These tend to be slightly older dogs than our atopic population, so these are dogs starting in middle age, and certainly the most common cause of our experience of otitis externa in middle-aged dogs with no previous history of otitis is hypothyroidism. Often they have generalized signs of disease, they have poor hair coats. Little giveaway sometimes if they have alopecia on their noses. They can of course show other systemic signs. They're heavy dogs, they're lethargic, sometimes they have pyoderma. Typically they may be lethargic as we've said, alopecic, overweight animals. You can see here this large Neapolitan Mastiff with this typical tragic facial expression that we see with thyroid disease. Sometimes it only affects the ears, and it can affect the periphery of the ear, as you can see here. Interestingly, very little erythema on this dog's ear pinna. You can see around the periphery of the ear this crusting, which is very typical of the signs that we'll see with thyroid disease. Some of these dogs have some alopecic change, as you can see. This has got some crusting again, but alopecia on the ear pinna. This dog has hypothyroidism. Another dog again, you've got hair loss on the pinna of this dog's ear, and if you were to try and gently tug at the hair along the periphery of this dog's pinna, you'd find it's very easily epileptic. Inside the canal, typically they have a ceruminous otitis externa. Often they'll have malassezia, but they can of course have bacterial infection with Pseudomonas or with Staphylococcus. Cushing's disease, predisposed breeds with Cushing's, all the ones that you'd expect, Dachshunds, Boxers again, Boston Terriers and Poodles. These tend to be a slightly older population than our hypothyroid dogs. These tend to be middle-aged, and many of these dogs are in excess of 8 years of age. So again, we have a dog with otitis externa, no previous history of ear disease. It gets to 10 and suddenly it develops a Pseudomonas otitis externa. We start to worry about generalized immunosuppressive factors, things like hyperadrenocorticism. Often they have skin disease, the typical signs that we see with Cushing's, the thin skin, the symmetrical alopecia, but you can of course see dogs who have none of those signs. They may just have signs of otitis externa as a presenting sign of their hyperadrenocorticism. So a dog with ear disease that looks like this obviously is very easy, very typical Cushingoid dog. But if it's like this, it may be just a little bit more subtle. This dog's got some signs of alopecic change, but this dog has otitis externa due to Cushing's disease with little else in the way of generalized clinical disease. Signs on the ear pinna, often you'll start to see signs of alopecia on the ear pinna, as you can see here. Sometimes, as you can see on this Doberman's ear, the ear pinna is very thin. You can see, as you might see on some of these dogs' ventral abdomen, the very fine vasculature that's very typical of Cushing's disease, diffuse comedone formation, as well as the alopecic changes that are there as well. Inside the ear, you'll often get very severe infection. These animals are immunosuppressed. Not uncommon to see signs of severe bacterial infection rather than yeast. Staphylococcal infection, Pseudomonas infection are things that we would often find. How do we investigate endocrine disease? Well, of course, we need to do some basic cytology as we do with any of the cases that we're investigating. Routine haematology and biochemistry I think is an absolute must on all of these cases. Then of course our standard thyroid profile, and typically we do a free T4, total T4, we do a TSH, and we'd also do our autoantibody levels. Remember, if these dogs have got infection, they will have suppression of their total T4. These animals are going to be euthyroid sick, so you need to do an extended profile. Only doing a total T4 is going to be of very little value. Certainly if I was suspicious of Cushing's disease, certainly if I had changes on routine haematology, I may want to go on and do some of the dynamic function tests. And we would tend to use the low-dose dexamethasone suppression test as our first screening test in our Cushingoid dogs. We may also do ultrasound and further diagnostic imaging as well. Therapy, we have to remember, of course, if we find a dog that's profoundly affected, it's got an underactive thyroid, we've got a dog that's got Cushing's disease, you still need obviously to treat the infection. So you need to treat the infection aggressively, you need to treat the dermatocosis as you would do normally, and you only start to taper off the treatment for your infection and for your parasites once you've got that underlying disease under control. So I'll maintain my dog perhaps on topical treatment for its dermatocosis, or perhaps systemic spot-on treatment for its dermatocosis, until I've got my dog's thyroid levels back to within the normal range, until I've got some post-pill levels that are in the high normal range. So dealing with the primary trigger, making sure that underlying disease is stable before we start to switch on to our maintenance therapy and then thinking about withdrawing our treatment. Let's, in the last few minutes we've got, look at some of these less common causes of otitis externa. You can see them there listed. Immune-mediated disease. The ones we see most commonly of those rare diseases are, of course, pemphigus, lupus, and then one that we tend to see quite commonly in referral practice, erythema multiforme, possibly because it's a very severe disease. It causes very severe ulcerative lesions on the ear pinna. This is a dog with very severe pemphigus though, and this is a Yorkshire Terrier we saw a few years ago now, and this dog had pemphigus foliaceus that only affected its ears. It had no signs elsewhere on its body, no signs of foot pad hyperkeratosis, no primary pustular lesions on the rest of its body, so something that you need to be aware of. This is an Akita. We commonly see pemphigus in the Akita, and pemphigus in the Akita commonly affects the ears, commonly affects the nose, but certainly in our experience can affect very little else of their body. When you look down the ears, you can often see those primary pustular lesions, as you can see here, as you see on the rest of the skin. And this is obviously crying out for cytology. If you can get some pus from some of these lesions, have a look at them under the microscope. Typically you'll see acanthocytes, you'll see non-degenerate neutrophils there, particularly if there's no infection. Typical signs of pemphigus. We also see pemphigus foliaceus in the cat, and again it can cause very profound signs in the ears. You can see on this cat here you've got crusting around the periphery of the ear. Often the ears are so severely affected, the crust almost weighs the ear pinna down, and again this is crying out for cytology. Picking off these crusts, impression smears onto a slide. You get, again, you're looking for non-degenerate neutrophils, you're looking at acanthocytes, the typical signs that you'll see with pemphigus. This is a cat with discoid lupus. Lupus can affect the ear pinna in both the dogs and the cats. It's a much more aggressive disease than pemphigus because it's affecting a much deeper part of the skin. So this is a disease that's attacking the dermoepidermal junction, causing very severe ulcerative lesions. And again, as you can see in this cat, he has very little else. It has little in the way of periocular disease or nasal disease. This is only affecting the ears themselves. This is a case of erythema multiforme, ulcerative, aggressive disease. Erythema multiforme is, of course, a disease that's got multiple underlying triggers. We see it associated with a history of drugs. We see it associated with internal disease. For example, we'll see it with cardiac disease, with liver disease. We'll see it with renal disease. Internal neoplasia can do it. We've seen it associated with immune-mediated disease, for example, like rheumatoid arthritis. So a whole range of different triggers for this very aggressive disease problem. This is one where we really do need to start hunting for a needle in a haystack, but where, for example, biopsies of this lesion would give us a clue for the underlying etiology, would then allow us then to progress that and investigate it further. Keratinization disorders, the main keratinization disorders that we're considering in dogs as primary triggers are things like sebaceous adenitis, primary seborrhea, and then the very uncommon disease, these vitamin A responsive diseases. Sebaceous adenitis can present on the ear and can present as only signs of otitis externa, like many of the diseases we've talked about tonight. Typically you get this white, scaly types of lesions on the ear pinna, you get diffuse alopecia. If you pluck these animals' hairs off, they come out very easily epilated, and they have follicular casts, little crusts around the hair follicles. These dogs can be really, really difficult to manage because not only are they destroying the sebaceous glands in their own skin, this immune-mediated attack against their sebaceous glands, which leads to this dry scaliness on their skin. They also destroy their sebaceous glands in their ears, which means these dogs, as you can see from the right-hand side, often have very little earwax. This means you have to be very careful how you clean these dogs' ears and how you manage these dogs, because if you use acidic or aggressive ear cleaners, things that are potent rheumolytics, you will find these dogs' ears ulcerate very easily, and they will go on then to develop things like Pseudomonas otitis. So in things like Otitis, which is one of the breeds that we see highly predisposed to this disease, is something that you need to consider. Primary idiopathic seborrhea are a very rare disease. Typically we're seeing this in the spaniel. This is a disease that is a diagnosis of exclusion. We need to rule out other things like thyroid disease and allergy. But these animals typically have this thick ceruminous discharge inside their ears, and it's basically management of the wax with cleaners, possibly steroids to try and reduce the wax production. Foreign bodies, typically these are unilateral, so we're seeing these animals in first opinion clinic. These are animals that are coming into us with no previous history of ear disease, acute onset disease, very, very painful, very uncomfortable. Naturally occurring foreign bodies, of course, things like plant material, grass horns, we particularly see in the summer months, we particularly see in Cocker Spaniels, but you can see soil, you can see in sand, particularly if you've got animals, for example, that are swimming in dirty water. Something we also see through our clinic is we see an iatrogenic introduction of foreign bodies into dogs' ears, and we have a product in the UK which is called canker powder, which is used in ears by some groomers, and that can dry out and form hard, solid lumps in the bottom of ear canals. You can see in these here. This one on the left-hand side here you can see quite clearly. We've got a whole collection here of grass horns inside these dogs' ears. These dogs are acutely painful if you just put gentle pressure on the horizontal and the vertical canal. And of course, if it's left untreated, if these animals continue to head shake or rub their heads, these grass horns can of course penetrate the tympanic bulla, go through into the middle ear and induce very severe otitis media. This one on the right-hand side, you can see this telltale white powdery debris that's at the bottom of the ear canal, very typical of what we'll see with someone who's filled their dog's ears up with canker powder that will just sit at the bottom of the ear canal, solidify, and again can cause tremendous irritation. Finally, our miscellaneous diseases. There's lots and lots of miscellaneous diseases that can cause otitis, but this is one which I think is very important to be aware of. That's juvenile cellulitis. This is something that typically comes into the clinic in very young puppies. These dogs will obviously develop this horrible sterile pustular disease. They have swelling of their muzzles, they have swelling around their eyes, but they can start with purely signs of ear disease, this horrible exudative discharge that you see from these dogs' ears. Major differential diagnosis, of course, would be something like allergy, particularly food allergy in a very young animal. Major differential would, of course, be things like dermatocosis. So you need to be thorough, do some cytology on these animals, make sure there's no parasites there. But once you're confident that's what you'll deal with, you can see this one on the left-hand side here, no facial signs at all, only ear disease. Once you're confident you know what you deal with, these animals need to have steroids. The canals are erythematous, they're ulcerative. If you get these dogs onto steroids quickly, onto prednisolone at full anti-inflammatory dose rates, you can turn this disease around and stop it progressing and stop the scarring that can occur as a result of this very severe inflammatory process. So let's just summarize as we come to the end of our session today. If we're looking at dogs with chronic disease, we're looking at dogs with severe disease, particularly things that with animals that have severe Pseudomonas otitis, particularly dogs that are developing multiply resistant infections. It's really, really important to identify and treat those primary triggers. It's only by identifying those triggers and managing them successfully that you can prevent these dogs to go on and prevent them developing chronic irreversible change in the ears, preventing them develop multiply resistant infections. You treat the infection, we need to treat the parasites, and then what we can then do is we can then start to think about tapering off their treatment. But until you've got that primary treatment controlled, you need to put these animals on some sort of holding therapy. So typically if we've got a dog with a Malassezia otitis, it's got atopic dermatitis, we're starting it on perhaps its allergen-specific therapy. I'd keep it on some sort of maintenance therapy for its Malassezia until I've built that vaccine up, until I've got it up to its full therapeutic dose rate. Only then would I start to taper off its treatment. So you need to manage the infections, manage the parasites, and then start to taper that treatment off as we control our primary disease. Remember, allergy is the most important and the most common cause of otitis externa. 75% of the cases that you're going to see through your clinic is caused by allergy, particularly atopy. Don't forget food allergy. Don't be frightened to food trial these animals. Thyroid disease is the most common cause in middle-aged and elderly dogs, so a thyroid profile should be part of your minimum database in a middle-aged dog as well as your basic cytology. And thank you, that's us finished for tonight. I'm very happy if any of you would like to take some questions.
Sue, thank you very much for a fantastic and a very visual presentation. The photographs in there were really spectacular, some of them, some very, very good representations of the diseases. We actually do have some questions for you, and the first one actually relates to dietary trial. And the question is, if you have been feeding a dog a hydrolyzed diet and you then re-challenge the dog with the original diet, in what sort of timescale are you looking for a reaction to that original diet to recur in?
It's very, very variable. Some dogs will flare within hours of having their diet, but certainly some dogs can take up to a week before you'll see relapse. And that's why I suggested that when I'm talking through owners how to undertake dietary challenge, I usually write down for them what I want them to do. So we'll add each new food on a weekly basis. In a perfect world, you'll add an isolated protein source, an isolated carbohydrate source, but if you do that, it will take you years to reintroduce their original diet. So what we generally do is reintroduce their original dog food. If it then flares, what we'll then do is look at the individual components of that dog food to see if we can identify which specific part of it's causing relapse. But often they'll relapse very, very quickly.
Fantastic, thank you. I've got another question for you. This one's a feline question, and it's come from one of our attendees tonight. And she said she's seen a few cats with chronic otitis, and she's seen abundant pigmented lumps in the canal wall. They don't appear to be painful, and they don't bother the cat. Can you tell her what they are, please?
I suspect they're probably something like serumnus gland adenomas, which are quite common in the cat's ears. If you're worried, you could quite easily biopsy them. If you get a little curette, scrape off some of it and send it off. You can get quite a decent sample, send it off to your pathologist, but I suspect that's what they are.
Okay, thank you. We've got another question that relates to ectoparasites, and the question is, when mounting earwax on a slide with potassium hydroxide, what's the best method for doing this?
What I'll generally do is I'll put a little drop of potassium hydroxide onto the slide. What I'll then do is I'll then get my earwax sample and I'll then mix it in with the potassium hydroxide. I'll then put a cover slip on it, and then either you can leave it to stand, in which case it will clear by itself naturally, or if you're impatient like me, you can either, some people will put a lighter underneath it, but we have a hand dryer that we have in our lab, and we'll hold it under the hand dryer, which will just heat it up a little bit and just clear it that little bit more quickly before we then examine it underneath the microscope.
Okay, thank you. We've actually got another question. I know this is one you get asked quite a lot. And the question is, do you recommend routine plucking of hairy dog ears?
I think it very much depends on the dog. There are two thoughts really on this. The first of those is that if the dog's ear is very hairy, then that's obviously creating environmental changes within that dog's ear. It's getting hot, it's getting humid, it's preventing adequate ventilation. So there's an argument to suggest in that dog, by plucking the hair out, you're going to improve the ventilation and improve the environment in there. The other argument is, say, if you have a dog with ear disease and you pluck out the hair, you're actually producing microtrauma. And the ladies in the audience who pluck their eyebrows will know that when you pluck your eyebrows, the next day you've got slight erythema there because you've done microtrauma to those follicles. So traumatizing the follicles can then lead to infection and then can exacerbate the disease. So what I generally will say, if they're very hairy, I would do a small amount of gentle plucking, but if I'm going to pluck that animal's ear, I would use an antiseptic ear cleaner afterwards, and I would like something like, for example, a chlorhexidine, perhaps Tris-EDTA cleaner in that dog's ear just to freshen it up. But I won't go mad. I'm not one of these people who'll start plucking dogs' ears for the sake of it. And certainly if that dog has no history of ear disease, I would not routinely pluck its ears at all. I'd leave them entirely alone.
Okay, thank you. I know that's a very common question. You do.
It is.
We've got another question about hydrolyzed diets. This question has come in and it says, if the problem has cleared up on the hydrolyzed diet, is it really necessary to reintroduce the normal diet to see if a flare-up reoccurs? And the reason for asking this is some of the owners aren't keen on the idea, and they feel that if the problem appears to have got better, why do they want to cause the problem again?
I think first of all, in order to establish it's a food allergy, you've got to challenge. And it may be that challenge is just briefly just to establish that it's a food allergy. I have no problems with animals staying on hydrolyzed diets over a long-term period. The problem with some of the hydrolyzed diets is some of them have slightly lower palatability, and so they're not acceptable to some dogs. What's often quite useful, and certainly some of the dog food firms, for example, firms like Dechra, of course, have hydrolyzed diets, and you can then almost do like a sideways step to maintain them on a low allergy diet that isn't necessarily hydrolyzed. So you can keep them on it, but usually there's a problem with palatability. Often there's a problem with cost associated with it, so we tend to do a sort of sideways step by maintaining them on a low allergy diet.
Okay, thank you. That's fantastic. On behalf of us all, I would like to thank you very much for an excellent and a very practical presentation. I'd like to thank everybody for joining us this evening. We've had a truly international audience. I do hope you've enjoyed the presentation and that you'll join us again at the same time on the 2nd of May for the next masterclass webinar entitled The Gold Standard Case Management of Otitis Externa. Thank you all very much and good night.